Pharmaceutical companies are faced with an enormous burden to bring new treatments for allergic rhinitis to the general public. These mountain-like obstacles include rising costs, increased issues with scientific rigor by researchers, and more regulations that complicate the already difficult human testing phase of bringing to market a new treatment. When it comes to finding an experienced and proven facility to conduct controlled allergen exposure type study for allergic rhinitis, this presents a singular challenge for pharmaceutical companies, particularly given that over the last 10 to 20 years, several new environmental exposure facilities have emerged with varying results and scientific quality. That's where the EEU can provide a unique and rewarding experience. The EEU, or Environmental Exposure Unit, is a specially designed facility that delivers consistent and reproducible levels of allergen under tightly controlled conditions. What makes working with our facility a productive experience? 4 key characteristics: our location, our affiliations, our history, and the facility itself. First, consider our location. Located in Kingston, Ontario, the EEU is one of the only exposure facilities to be located directly inside a hospital. The EEU is located in the Kingston General Hospital, an acute tertiary care academic teaching hospital. The EEU is directly above the emergency department. This provides the safest environment to carry out any clinical trial. Additionally, being in the highly populated southeastern Ontario region, participants have been recruited and managed from all over the province. Next, consider our affiliations. We are associated with the Kingston General Hospital Research Institute, one of Ontario's top hospital research organizations. The EEU is also affiliated with Queen's University, one of the province's most prestigious academic and research institutions. The principal investigator directing the EEU is Dr. Anne Ellis. Dr. Ellis is a practicing allergist, an associate professor and chair of the Division of Allergy and Immunology in the Department of Medicine at Queen's University, who was trained and mentored by the former EEU director for 9 years. This provides a level of expertise unmatched when it comes to research involving allergic rhinitis. Now, consider our history. The history of the EEU is unmatched. The EEU was originally conceived by engineering professor Dr. Reginald Clark and Dr. James Day in the mid-1980s. This is the first environmental exposure facility to be established in North America, and it has been in regular operation for over 25 years. It is the gold standard when it comes to clinical trials that involve exposing allergens to participants. The unit has been used to conduct over 36 clinical trials. Match this with the experience of Dr. Anne Ellis, who has been involved in most of the trials completed in the EEU. This level of expertise is unmatched in the sector. Additionally, key members of the current EEU research team have been working together for 10 or more years. This experience leads to trials that go smoothly and efficiently. Lastly, let's consider the facility itself. The Environmental Exposure Unit is a fully validated, GCP-compliant, internationally recognized research facility to study allergic rhinitis under controlled conditions, a model that is recognized by both the US FDA and the European Medicines Agency to assess anti-allergic treatments. Study participants are enveloped in air coming in at the front and leaving at the rear of the roof. The EEU is compliant with HVAC system standards for clinical facilities. The air intake is directly opposite Lake Ontario. 100% fresh outside air passes through multiple filters equipped with the same HEPA filters used in biosafety cabinets to ensure ultra-clean air. All the air is then exhausted and never recirculated through the intake ducts. Outdoor air contains particles from traffic, bacterial endotoxin, as well as seasonal mold spores and pollens. These are completely removed by the filters. The temperature and relative humidity are continuously maintained within narrow tolerances and continuously recorded. Allergen preparations are tested to rule out contamination by fungi and bacteria. During each study, various air quality parameters are measured to ensure that no unexpected contaminants are introduced by the building systems or study participants. Regardless of where a participant sits, pollen concentrations in the envelope of air are the same. There are multiple pollen counters distributed throughout the treatment area. These monitors have been calibrated by comparison with other methods. This ensures our research participants are reflecting on their symptoms related to the allergen intent. The EU's pollen dispersion system features a custom-engineered multi-step process that sets it in a class of its own to ensure pollen use efficiency and system reliability, which translates to consistent room concentrations. The EEU's allergen dispersion system circulates pollen through the room at concentrations similar to outdoor air during the relevant season. The EEU is one of the largest allergen exposure facilities capable of seating up to 140 participants. To capture the results of allergen exposure, state-of-the-art scanning equipment is used to read symptom diary cards. We are also developing new tablet technologies to provide even faster capture of symptom diary card data. The EEU has been validated for use with ragweed, grass, and most recently birch pollen. This all results in a productive and rewarding experience for both pharmaceutical companies and participants. But you don't have to take our word for it. Listen to what others think of the EEU Experience. Professor David Miller from Carleton University in Ottawa has the following to say about the EEU.
In the past 20 years, a lot of pretty high-quality data has emerged from the EU, and I'm primarily a toxicologist. So I look at the results of studies in animals and non-human primates that are done under very controlled conditions for organisms that are highly bred. Here, data are being produced that are reproducible with a big array of humans. That's an exceptional achievement. It's impossible to imagine another facility that could do that so well.
What about the study participants? Listen in as one participant describes his recent experience in the EEU. So how do you feel that room? Is it working?
Oh, it's definitely working. Yeah, the allergy, the effects, the watery eyes, the itchy eyes, plugged sinuses.
And how have they been looking after you here? Pretty good?
Oh, really good. Yeah, the staff's fantastic, and very supportive and helpful. It's been a good experience that way.
So as you've seen, the EEU offers a truly unique experience based on its location, our affiliations, our history, and the facility itself. So next time you need to use an environmental exposure facility and you want to guarantee high-quality results and full compliance, contact us at the EEU. We guarantee that you will find your time working with us truly an enjoyable and rewarding occurrence.